Welcome back. Thanks for joining me tonight. All right. I was down in Bloomington at Illinois State University on Thursday night and headed to an event. Here's who was outside of that event, if you can listen closely.
Hands off trans bodies! No assimilation! Trans liberation! No assimilation! Trans liberation! No assimilation!
Okay, I'm outside ISU for the Chloe Cole event. It's going to be awesome.
Say it louder, say it clear! Transgender is not welcome here! Say it louder, say it clear! Transgender is not welcome here! When trans are under attack, what do we do? Stand up, fight back! When trans are under attack, what do we do?
Trans rights are under attack. Trans simulation. I mean, these people, like, they're protesting the Chloe Cole event. Of course, Chloe Cole has been on my show before. She is a detransitioner at age 12. They started her on hormones, her doctors. By age 16, she had her healthy breast cut off. Shortly after that, she had regret, figured out that she had gone down the wrong path completely, and she's now involved in a lawsuit with her doctors because they bamboozled her, her parents, and everyone. And so she was there to discuss what she went through. And of course, you had a bunch of trans rights activists out there protesting her. It's just incredible, especially in light of the fact that there is a new study out saying that shows that gender madness, non-binary was just a fad pushed by radical activists. This is a post from New York. This is the New York Post. Carol Markowitz wrote this story. And they apparently, Eric Kaufman, a professor of politics at the University of Buckingham, compiled a report for the Center of Heterodox Social Science titled CHSSS Report Number 5, The Decline of Trans and Queer Identity Among Young Americans. The report draws on data from several sources, including annual campus surveys done by the Foundation for Individual Rights and Expression, a higher education research institute survey for incoming college freshmen, as well as various other studies. Kaufman found that the share of young people not identifying as male or female, typically taking the non-binary or questioning options, has declined substantially since its peak in 2022-2023. So that's good news. Unfortunately, it also seems that in the kid department, though, actually trans identification is increasing. So we've got a sort of mixed results here. But here to talk about the entire situation when it comes to the transgender issue and the medical community is Dr. Carrie Mendoza. She is running for lieutenant governor here in the state of Illinois. But prior to her running, she really was just been an activist on this issue. She's actually done presentations with Chloe Cole. She's also a mother of 3. And she joins me right now. Carrie, thanks so much for being on The Real Story.
Oh, Jeannie, thank you so much for having me.
I forgot to mention that you are an ER doctor in Chicago at Safety Net Hospitals.
That is correct. Yes.
Yes. Well, this is, I'm really glad that you're wading into this area. I mean, Ted's campaign is really big. What you guys want to do in the state of Illinois is, turn rights back to parents most and foremost. But your advocacy on this issue is really important in Illinois. And I just wanted to tell me, first of all, how did you come to this issue as something that you cared enough about to join the Board of FAIR and then go out and publicly discuss it across the country?
Yeah, well, it is such an important issue, as you were highlighting, just those protests for Chloe talking about basically medical malpractice on her, and people are protesting that. So, I got involved, in 2021 after the George Floyd riots. I got involved with just trying to fix illiberalism that was growing in healthcare. And I started really learning more and more about the trans issue as it related to pediatrics. I've cared for transgender adults, but I really wasn't exposed to the issues going on in pediatrics. And so I read about Chloe's story, and I was just shocked. And it really brought up in part echoes of what I saw during the opioid crisis, how that had gotten out of hand with ignoring victims, doctors not speaking up, and this element that I was seeing with shaming these detransitioners who were saying, wow, I was really harmed. So I was just so concerned, and I got involved to speak out about the issue because so few doctors were speaking out.
Okay, that's great. And then what did you find? I mean, how do you even square the circle here that doctors are allowing a 12-year-old to take hormones that can chemically castrate her and then are cutting off her breasts at age 16? How does that sit in the medical community? I don't understand it at all.
Yeah, it's again, because I had early in my career had practiced as the opioid crisis was taking hold. I saw just a lot of just bad elements in our healthcare system, and again was echoing with what I saw in pediatric trans. And there's just a few high-level things, first being that healthcare really has become consolidated, kind of this factory line approach and an over-specialization. And so we have a loss of independent practitioners, and that really accelerated with Obamacare when it was passed in 2010. And you also in there had this whole rise of what I call the MBAization of healthcare, where you had this like patient experience scores where that was tied to revenue in the hospital and for doctors. So doctors were picking, should I be liked versus doing the right thing sometimes. And that's part of how the opioid crisis got out of hand. But that's part of the backdrop in this. And then the pediatric gender clinics entered our country, the first one in 2007 in Boston. And yes, that was before Obamacare, but with this consolidation and sort of factory line approach, these gender clinics for youth popped up. And for Chloe, who had all this happen to her through Kaiser, that's kind of the poster child of a lot of this. And in there was this theory that if kids who had confusion about gender were treated as youth, it would decrease depression and then decrease suicide. And then just the other things quickly, civil rights laws were written into Obamacare as regulation in 2012. So gender was added to sex. So it created this backdrop where healthcare clinics and hospitals, as well as insurance companies, felt if they didn't go along with these things, they would be called out as discriminatory. And then lastly, the way the changes with big pharma and psychiatry and psychology happened, that there really was a move towards treating emotional, spiritual problems with like material solutions, so pills and surgeries. And when these kids entered all of this, a lot of them, when I've talked to detransitioners, were already on medicine for ADHD or depression, anxiety. So when this gender dysphoria came about and they show up at a clinic, it was this system that was like a fast track. And that's how someone like Chloe showed up at Kaiser and just went almost like assembly line where no one was speaking up. The doctors want to be liked. They're convinced it's an antidepressant treatment. And this is how these detransitioners and these kids are being harmed.
Wow, that's a really great comprehensive explanation of what happened. How do we now going forward? Not only did Trump essentially say, if you do any of this trans processes on minors, we're going to pull all of your Medicaid, Medicare funding, where you're not going to get it. So you've seen some hospitals tell us now that, we are not, we've stopped. Like Lurie Children's wants you to believe that they've stopped promoting trans procedures on kids. Okay. And of course we had Dr. Heim on my program too. He's the whistleblower in the Houston area that was then brought under the DOJ investigation and indicted and going down this whole trial under Biden. Of course, Trump stopped that as well. I know his lawyer personally. So We covered that case too. But have you seen a
Great.
change? Is there a change? Where do we go from here in the medical community? Is Trump being effective, or are they hiding it?
Yeah, a great question. I mean, there is no doubt that President Trump, has done an incredible job in this area and was well prepared, as I think is really one of the areas of focus, in between his first administration and everything that happened with the Biden era. They were really well prepared with these executive orders. So clearly the taking away of funding, critical. I mean, these major clinics across the country really all came out slowly, but did that they were stopping. There was an ongoing NIH-funded study at Lurie's, LA Children's, Boston, that basically stopped. So hugely important. Congress has not yet passed a law making it illegal for under 18. So I don't know if they're, taking more of the approach they did with abortion. But I do think there's been big changes. That's so important. But I think that we have a lot of work to do still, because it is not illegal for under 18. A law has not been passed, as I said. And also there's just a very entrenched pipeline, as we see on other cultural issues. And the pipeline, in part, is because this is still in schools promoted. Yes. And so that is key to still work on.
Well, that's what I wanted to go to, because Chloe Cole, basically, she said that what happened is that she obviously had some issues. She talks about her family. Her family was not really religious. They didn't know how to handle her. She had 4 older brothers. She was sort of a tomboy. She wasn't acting out. She just wasn't feeling herself. She didn't feel like a girl. And so she said the problem is that when one person affirms your feelings, then it snowballs from there. And so her comment was, you cannot affirm this at all. It just don't weigh in that way. And that, I think that affirmation is coming from the schools, and obviously social media, definitely there, but then the schools are reinforcing it. And I think that's our bigger concern, because we still have that problem in the state of Illinois. The day of silence is still around. You still have Lurie's Children's Hospital, even though they may not be doing the procedures now. They are embedded in the Chicago public school systems, where they have they collude with the school system to bring either a youth engagement coordinator who is themselves trans to go and promote this stuff.
Exactly. That the pipeline concept is just so critical to understand the elements. And in there, Jeannie, of course, we have to mention, how dangerous it is, this, mental health screening that, Pritzker signed.
Yes. What about that?
Yeah.
Tell me from a doctor perspective, what about that?
Well, yeah, of course, that's, just completely, inappropriate. We know our schools, so many of them are challenged just doing what their core mission is of, ABCs. And so to add this all in is really, unconscionable. But the reason I brought it up now is part of the pipeline is that in some states, and of course the big blue states like ours, they have basically tried to, criminalize therapists who, they basically say therapists who raise the gender dysphoria issue as, something related to depression, anxiety, other things, versus a fixed issue that can't be changed. That is called, quote unquote, conversion therapy. So they added, in these blue states like California, Illinois, New York, they added gender as part of, quote unquote, conversion therapy, as some of these states have passed in relation to a therapist trying to change someone's sexual orientation. And so by doing that, you're basically, telling a therapist, well, you could lose your license. You could get in trouble if you ever suggest that if a child shows up with gender confusion, it's anything but we must affirm them. And so that's very, very important part of the pipeline. And there is in Colorado, like the cake baker case, there is a therapist who, is going through the legal process, a Christian therapist, to say that, this is not, believe that she's going on First Amendment rights. So
that's great.
So it's very, very critical part of the pipeline that, you have some activist therapists, but also therapists who don't believe in this, but then are scared they'll lose their license or scared to speak out, maybe in a clinical forum. And so then if you, again, have a gender confused child show up, here you are again, quote unquote, affirming. And that's part of how this is gotten out of hand.
That's what Chloe said directly. That people affirmed her and they shouldn't have. And and the schools affirmed her as well. And so that's where it all started. Right. Well, I could talk to you all night about this topic, but I can't because I have hard breaks. Right. So I'm going to have to let you go, but I really appreciate you. One last question. I know your son plays for Hillsdale. Did they win this weekend?
They did not, but I was great to enjoy, a Saturday at Hillsdale and see my son.
That's awesome.
Thank you so much, Jeannie, for everything you do and just the chance to share this information.
All right. She's Dr. Carrie Mendoza. She's running for lieutenant governor here in the state of Illinois. She's very knowledgeable about this issue and a cultural warrior on it, and we appreciate her for joining us on The Real Story. We'll be